Hello, everybody. My name is Dr. Shantala. I'm a senior obstetrician in Bangalore. This video is about what you ought to be doing if you are under home isolation. Home isolation is one of the modalities of managing a COVID-19 positive patient, and this was proposed by the government of Karnataka from the 4th of July. It means that those patients who are COVID positive but have mild symptoms or no symptoms at all are eligible to be treated and monitored in their house itself under familiar environment. So this helps to reduce the load, the bed load on the hospitals also. But however, if somebody is under home isolation, there are a few things that the person must be following. And in this video, I'll take you through what you should be following if you're COVID positive and under home isolation. Now, once you are under home isolation, you should isolate yourself in a separate room, preferably with a separate toilet. You should be wearing an N95 mask always. Change it once every 8 hours when it gets dirty. The mask and all the other disposables that you have used and are disposing, they have to be disinfected. It's very important. It has to be disinfected with 1% sodium hypochlorite solution. It's very easy to make this 1% sodium hypochlorite solution. You can just take bleach, 7 grams of this, maybe a spoonful of bleach in 1 liter of water. That will give you 1% sodium hypochlorite solution. So the mask, or if you're wearing this gloves, or if you've used a tissue to wipe your face or dry your hands, all that should go and get it disinfected, should be soaked in this 1% sodium hypochlorite solution. Then coming to personal hygiene, you can take bath every day, keep yourself clean. Keep yourself well hydrated. Drink plenty of water, maybe around 2 liters of liquids, including soup and water. Warm water you can take. If you have sore throat, you can do warm water gargling. But most importantly, the idea of home isolation is to monitor you when you are in the house. And that is by the way of self-monitoring. So for this, you need to have a thermometer where you'll be checking your temperature at least 3 or 4 times a day. And then most importantly, a pulse oximeter. Pulse oximeter detects the amount of oxygen that is present in your blood. As we all know, in COVID, there's something called happy hypoxia. The patient will be very nice and happy in the morning, and by evening, the patient has desaturated. So it's very important to monitor the oxygen levels. So the pulse oximeter is just like a clip, and you can clip it on, preferably onto your middle finger, and record the oxygen saturation. So usually it should be more than 94. Then the third thing that you should be doing is, if you are diabetic, your sugars, you have to keep them under control. So monitoring of sugars is also necessary. And if you have a glucometer, it is very helpful. You need not monitor it frequently, maybe once in a day or once in 2 days if it is under control. Similarly, if you are hypertensive and if you have a BP apparatus at home, please self-monitor your BP. So under any of these, whenever you are under home isolation, if at any time you become breathless, or you have lot of unbearable cough, there is high degree of fever, lose motion more than 4 times, or you've lost your smell and taste, then all these conditions, or if you're feeling worse than what you were feeling the last 1 or 2 days, then you should be informing the authorities immediately. Usually it's the Aptamitra phone number helpline, or you can call 104 with extension 2 to say that your symptoms are getting worse and you need more help. That is when your home isolation might end and you may be taken to the hospital. Then coming to what you do, how do you, the food that you get. So usually the food is prepared at home and it is kept at the doorstep of your room, and you take the food inside. It is preferable that you use disposable utensils. Again, when once they are used, the utensils have to be dipped in 1% sodium hypochlorite solution before being discarded. If you're using steel utensils, then all these utensils after use should be washed with soap and warm water. Either you can wash it yourself or a caregiver can wash it for you wearing gloves. Again with soap and water, warm water. And regarding your clothes, the clothes that you wear, your bed linen and your towels, all of those must be washed with soap or detergent and warm water, or they can be machine washed with warm water, 60 to 90 degrees, and sun dried. Again, you can wash them yourself or your caregiver can wash this, of course, wearing gloves. This is about, and then finally, whatever medicines that you have been taking, please continue the medicines. And if you are in touch with your doctor, then you can ask the doctor for any other advice. Usually, we advise vitamin C and then vitamin B complex and warm water and the herbal tea, whatever you want, any nutritious food can be taken. Now, coming to the family, it's always better if there are three other people in the family and you've got isolated, all three of them now cannot go out of the house. You are under home isolation, they are under quarantine. They cannot go out of the house. And one of them, it is better that one of them gets identified as the caregiver for the COVID patient, preferably a younger person, preferably a person without BP, diabetes, and other comorbidities. So this person will be the person in contact with the COVID care person, bringing the food, keeping it to them and taking back the vessels. Always this person has to wash the hands before and after. Before wearing the gloves, wash the hands. After gloves, handling the utensils or his or her clothes, again wash hands after removal of the gloves. This person also should be wearing a mask and of course maintain the distance, the social distance. And another important job of the caregiver is to ensure that the patient is monitoring himself or herself, ensure that the patient is taking the medicines as usual, and ensure that the patient is in a good disposition to keep the person cheerful. This is also the function of all the family members, because all we all know that COVID is not fatal in all cases. It is the getting well, getting better is the norm in COVID. So more than 85 to 90% of the patients who got COVID always get better. So this should be at the back of the mind of everybody so that they can keep the patient cheerful and also they can keep up their morale. Meanwhile, the BBMP might have come and visited your house and they also assess whether it is okay for home isolation before allowing you to continue the same. They may even decide to swab all the people who are at home. And then when during the period of home isolation, if anybody in the house develops any symptoms of fever, cough, breathlessness, needless to say, that person also needs to be tested. Now, what is the duration of home isolation? Now, right now, the recommended duration is 17 days from the day of testing positive or up to 10 days of being fever free. So usually, and most importantly, it is not necessary to again retest after 17 days whether the COVID is there or not. You can just go back to your normal activities after 7 days. Now, the authorities who come and inspect your house will be stamping you as being on home isolation for about 17 days, and even they'll be putting up a notice on outside the house. It's also important for you, whoever is COVID positive, to update their status on Arogya Setu app. Having said all this, there is one important group that plays an important role in a COVID patient's life, and that is the neighbors, or that is the apartment, the other people who are staying in the other apartments. So the stigma that is attached to the COVID-19 is not correct. So the neighbors can be actually proactive and helpful. There is always the telephone to be in touch with. So any medicines that are required, any groceries or any vegetables, the neighbors should be able to help and not ostracize these people as being COVID-19 positive. And I'm sure that with all the cooperation of the neighbors, keeping a positive attitude, the family as well as the patient, we will all be able to see through this pandemic and come out of it victoriously. Thank you.